My name is Lindsay Schutz, and I'll be doing a head-to-toe assessment on you today. Is that okay?
Yes, it is.
Okay. First, I'm going to assess his head and scalp. And his head is no masses noted, no tenderness. His hair is blonde and evenly distributed. There's no oily hair. The hair is normal in texture. Did you have any pain when I palpated your head?
No.
No. His scalp is normal in mobility. There's normal facial hair noted on his face. His face is symmetrical. Can you smile for me? Can you frown? Can you puff your cheeks for me? Okay, good. Can you squint your eyes for me? Can you open your eyes really wide? Good job. And we're checking for cranial nerves 7 and 5, the facial nerves. And as far as the sinus is concerned, the frontal and the maxillary sinuses, are you having any pain or tenderness when I pressed here?
No.
No? Okay, good. What else? And then the lacrimal glands. Any pain when I palpate?
No.
Okay. The eyes are equal and symmetrical bilaterally. The conjunctiva is pink, moist. There's no lesions or drainage or exudate. The sclera is white with no jaundice noted, no bleeding or lesions noted. The eyelashes are evenly distributed on his eyes and his eyebrows. What else? The iris color is blue bilaterally with they're equal in size, and his pupils are also equal in size bilaterally with no deformities noted. I'm gonna do his he does have perla bilaterally. His visual fields. Tell me if you can look straight at me, and tell me if you can see my hand, my finger.
Yes.
See it here.
Yes.
See it here.
Yes.
Here.
Yes.
Here.
Yes.
And follow my finger from me to you. And his eyes converge as my finger comes to his face. I'm going to do a Snellen test with my Snellen chart that I have right here. And can you cover one eye for me? And can you tell me what that says?
The letter E.
And can you cover your other eye? Can you tell me what that says?
The letter E.
And he has 20/20 vision in both eyes. And then his cranial nerve 3 is also intact with his oculomotor. His EOMs are intact bilaterally, and he was able to follow my finger as, I did peripheral. Okay, can you follow my finger? His EOMs are intact bilaterally. And I'm going to have my light to test your reflexes. The optic dirt, check your pupils. Pupils are reactive and equal bilaterally. And I can see his optic disc. No. Red reflex. Pretend this is a light to test the red reflex, and his red reflex is bilaterally in both eyes, and is symmetrical. I'm going to check your optic disc and your optic nerve. And his optic nerve is visualized with no hemorrhaging or deformities noted. I'm going to check the other eye as well. And his optic nerve is also visualized in that eye. His retinal background his optic disc is orange and pink in color with with sharp disc margins and no hemorrhages noted. Ears, his ears are symmetrical and equal in size and normal in size. Do you have any tenderness when I pull?
No.
No tenderness.
No.
There's no drainage, there's no redness, there's no lesions noted on the outside of the ear. When checking the inside of the ear, pulling back and up, his ear canals are pink, no redness or swelling or drainage noted. His tympanic membranes are pearly gray with a positive light reflex, and there's no drainage noted on them as either. I'm going to do what's called a whisper test. I'm going to cover your left ear and tell me what I say.
Applesauce.
And cover your other ear and tell me what you say. Tell me what I say.
Pink balloons.
Yes, good job. And I'm going to perform the Weber and line test with my tuning fork. And I'm going to test for bone conduction versus air conduction. And just, do you feel the vibrate, or tell me when you can't hear it anymore?
I cannot hear it.
And then can you hear it still?
Yes.
And is it louder than it was before?
Yes.
Okay, good. And same thing as the other side. Can you hear that? Yes.
Yes.
Sorry. And can you still hear it?
Yes.
Okay, good. So that proves that the air conduction is greater than the bone conduction, which is good. The nose is equal, or is midline, and is symmetrical. There's no lesions or redness or swelling or masses or drainage noted coming from the nose. What else? I'm going to have you tilt up, and inside the nostrils, the nasal canal is intact. There's no redness noted, no swelling, no drainage. The turbinates are also symmetrical with pink and moist, and no redness or swelling noted either. I'm going to check the olfactory nerve with, close your eyes. Can you tell me what this smells like? Orange.
An orange.
Okay, good job. Oh man, good enough. Okay, I'm going to assess his lips. They are also symmetrical and no redness or swelling or lesions or ulcers noted. Can you open your mouth for me? And his tongue is pink and moist with also no ulcerations or lesions. His soft and hard palate are intact with no lesions or redness noted. His teeth are also all there with no cavities or caries or any infection noted. Can you lift your tongue up and down and to each side? Okay, good. And can you say ah for me? His uvula is midline with no shift or with no deviation, and his tonsils are +1 with no swelling or exudate noted. And I'm going to test your gag reflex. Can you say ah? And his gag reflex is intact. What else? For his neck is symmetrical, and there's no masses or lesions noted. Do you have any pain when I palpate?
No.
No. There's no visible lymph nodes either. His trachea is midline without deviation, and his thyroid is also midline without deviations. And I'm palpating the lymph node, or the thyroid. It's smooth with no nodules noted. Are you having any pain?
No.
Can you swallow for me? Good. And there's no goiter noted as nodes. I don't feel any lymph nodes anywhere. No lymph nodes noted. And then with the carotid, with +2, strong bilaterally with no frills felt. And then on auscultation, there's no bruise noted as well. Skin overall is pink, or is dry, moist, or dry, intact with no tenting, and no lesions noted, no masses, no deformities, no amputations. His skin is soft and I think I said warm already, but it is okay. Anteriorly, his chest is equal, symmetrical, and no deformities noted. Respirations are even, with no use of accessory muscles and no shortness of breath noted, or any acute distress. Are you having any kind of pain on palpation?
No.
No pain. No crepitus noted. I'm going to palpate tactile firmness. Can you say 99 for me?
99.
And again?
99.
And that's equal bilaterally. Percussion is resonant throughout. From his breath sounds. Deep breath for me. Another one. His lung sounds are clear and all filled with no wheezing, crackles, or coarseness noted. And as far as his heart sounds are, you could breathe normal. S1 and S2 were noted with no murmurs, gallops, or rubs. Posterior chest, his skin is intact. There's no lesions noted, and no masses. Lung sounds are. Take a deep breath for me. Another. But lung sounds are clear in all areas. I'm going to go ahead and take a deep breath for me. His chest expansion is equal bilaterally. Are you having any pain or tenderness?
No.
No. And no pain when I do that?
No.
No CVA tenderness. No crepitus or pain on palpation. His percussion is resonant throughout. His breasts are, go ahead and keep your arms at your side and arms out. I don't know if that's what I'm supposed to do, but you can come down. His breasts are equal in appearance. There's no masses. No masses noted, no lesions. And then, are you having any pain when I do that?
No.
Okay, good. There was also no spinal tenderness throughout his back, and no curvature, abnormal curvature noted. Abdomen. Oh, go ahead and have you lay down. So for the abdominal exam, his abdomen is symmetrical with no masses noted. His skin color is normal for his ethnicity. The umbilicus, there's no hernias or masses noted. Vowel sounds are present in all 4 quadrants. Also, the tympanic resonance or tympanic percussion is resonant in all 4 quadrants, and the percussion over the spleen is without any dullness. The vertical span of the liver dullness is 7 centimeters below the mid-clavicular line on percussion. The spleen is unable to be palpated, and the liver is palpated a centimeter below the RCM with smooth borders and no tenderness. Do you have any pain?
No.
And there's no pain and no masses noted on light and deep palpation. When I release, do you have any pain?
No.
No. So there's no rebound tenderness. And go ahead and take a deep breath. Okay. The Murphy sign is negative, and on the right lower quadrant, do you have any pain?
No.
McBurney sign is negative, and in the left lower quadrant, the Rousing sign is negative. I'm going to push your leg up against my hand. Are you having any pain?
No.
The psoas sign is negative, and I'm going to bend your knee and rotate it inward. Are you having any pain?
No.
Okay. The obturator sign is also negative. His inguinal nodes are not able to be palpated. For his skin, his skin is warm, dry, intact. No lesions or abnormal bruising noted. His skin has no tenting, and he's got no deformities noted. No peripheral edema either. His toenails and fingernails are intact with no ridges, no clubbing, and cap refill is less than 3 seconds. His pulses are equal +2 bilaterally strong on upper and lower extremities. And for range of motion, can you extend your neck backwards and forward, turn side to side, and touch your ear to each shoulder. His neck has full range of motion. Elbows, can you pull your elbows in, pull your arms in, and extend your arms out. And can you turn your hands up, down, and face up. His elbows have full range of motion. His wrists, arms back up. His wrists, can you flex your hands up and extend down. And fingers, can you flare them out and move your thumb. Okay. Full range of motion there as well. His lower extremities, can you pull your knees up and the other leg and extend your knees, extend your legs, and extend your feet up and down. His lower extremities have full range of motion as well. Can you stand up for me? Can you bend backwards as far as you can? Okay, good. And bend forward. Okay, good. Also, there's no abnormal spinal curvature and it's equal bilaterally. Can you his joints, there's no tenderness or swelling or crepitus noted in any of his joints. And I'm going to have you lay back down on our exam table. And I'm going to have you lift your leg up, straight up. Okay. Are you having any tenderness?
No.
In the other leg? Okay, good. Then that means he passed the straight leg raise test. For the Koenig sign, I'm going to bend your knee and extend it. Are you having any pain anywhere?
No.
No? Okay, Koenig sign is negative. And the Rudinsky sign, I'm going to lift your neck and bend your chin to the chest, and that is also negative. That's it. And for your neurological exam, I'm going to ask you what your name is
My name is Matthew Schutz.
and where are you right now?
I am in my house.
And what day of the week is it?
Today is Saturday.
And Matthew is alert-oriented to person, place, and time. And I'm going to have you hit your thighs with your hands and flipping your hands over and over again. Okay. He's got normal, rapid, alternating movements. And I'm going to have you close your eyes and touch your nose or your finger to your nose. And with the other hand. Okay, and open your eyes. I'm going to touch your nose and then touch my finger. And again. Okay, good job. And then also I'm going to have you take your right heel and run it down your left shin. And the same for the opposite. And close your eyes and do the same thing. Good job. He has normal cerebellar function. I'm going to take these objects. Can you close your eyes for me? And open your hand and tell me what this is.
Golf ball.
That is a golf ball. And can you tell me what this is?
Rubber band.
Rubber band. And I'm going to take your hand again and tell me what I'm drawing on your palm.
The letter A.
Okay, and your other hand.
The number 8.
Good job. So his sterignosis and graphesthesia are both intact. For his deep tendon reflexes, I have my hammer and his tricep and his bicep and his brachioradialis are all intact, as well as his patellar and his Achilles bilaterally. Good job. And for his strength, I'm going to have you extend your arms out and bend your elbows towards you, pull towards you, and push against me. Okay, good. And shrug your shoulders. Okay, good. And push against, and here. Okay, good. And can you have your hands out again and have you push your wrists up and down? Good job. And can you push your legs up against me and pull down? Good. And your shins out against me and back in. And push your feet up and your feet down. Good job. His strength is 5 out of 5 bilateral extremities, upper and lower. I'm going to have you stand up right now. And can you walk foot in front of the other like you're doing a sobriety test? Good job. You can go back. He's got steady gait. And can you put your feet together and your hands to your side and close your eyes for me? Good. He's got he passed his Romberg test, and then you can open your eyes. And can you have your hands out in front of you and palms up? Nope, turned up, excuse me. And then close your eyes. And he has no pronator drift. And if you could bend forward for me. He's got no abnormal spinal curvature, and his back is symmetrical bilaterally.